Hello, my name is Abdelaziz Alsharawy, and I'm a PhD candidate at Virginia Tech's Economics Department. In this study, we investigate how the experience of intense emotions, particularly fear during the early stages of the COVID-19 pandemic, influences economic preferences. A classical notion in economic modeling is that economic preferences are stable. There is a wave of recent studies, however, that contradict this notion. For example, willingness to take risks was influenced by exposure to financial crises, natural disasters, or violent attacks. This was also the case for social preferences such as reciprocity or contributing to the public good. We aim to understand how exposure to the COVID-19 crisis influences economic preferences, particularly during the early weeks of the pandemic. In this repeated cross-sectional study, we administered an online survey using Amazon Mechanical Turk for a sample of around 1,500 people residing in the United States. We collected a third of our data every 2 weeks, starting on April 2nd. There were approximately 200,000 confirmed COVID-19 cases by our first wave that tripled 2 weeks later before hitting a million by our third wave. For the number of deaths, it was a little under 3,900 in our initial wave and about 26,000 2 weeks later before surpassing 50,000 by our third wave. We aim at identifying how self-reports of fear of the COVID-19 pandemic influence economic preferences using survey questions that were experimentally validated. We thus measure risk aversion, time preference, altruism, and reciprocity. Here is our empirical model. In the upcoming slides, I will report the coefficients of self-reported fear, this beta, and local death rate, this gamma, on the measured economic preferences. Note, however, that we included state and survey time fixed effects, along with a series of individual level controls. Now let's look at some results. What I present here are the estimates for beta and gamma of the regression that measure how fear of the COVID-19 and local death rate influence our economic preferences. Again, while controlling for individual characteristics and state and time fixed effects. For willingness to take risks, we find that fear is negatively and significantly associated with risk tolerance. This association, however, was becoming weaker over time. We also find that local death rate during wave 1 is associated with lower risk tolerance. Again, this effect was fading over subsequent waves and actually absent in the pooled sample. For our measure of patience, we find that fear of the pandemic promoted impatience. On the other hand, we also find evidence that higher local death rate increased patience in our pooled sample. In our working paper, we discuss an instrumental variable approach that tests the robustness of these results, and it gives support for the credibility of our estimates for risk-taking and patience. Next, we turn to social preferences. When we look at altruism or willingness to give to good causes, we find that fearful individuals reported higher tendency for altruism during our third wave and in the pooled sample. Also, higher local death rate had a similar effect in our pooled sample. When we turn to negative reciprocity or willingness to take revenge, we find that fear of the pandemic is negatively and strongly associated with negative reciprocity. Again, the effect was fading across time. Note, however, that in our first wave, we find instead that higher local death rate increased willingness to take revenge. We also explored the drivers of fear. Even though local death rate was significantly and positively associated with fear, levels of reported fear had declined over time. Also, individuals who expected health hardships for themselves or their families due to COVID-19 were reporting higher fear levels. Expectations of financial hardship had a weaker association with fear levels, however. Importantly, we also find that trust measures are strong mediators of fear. Trust in people and government ameliorates fear, while trust in the media increases it, potentially due to stronger media-driven awareness of the pandemic. Additionally, stronger beliefs that people are engaging in social distancing were associated with lower fear levels. Note that political orientation was not a significant predictor for fear when we control for our trust measures here, suggesting that it's trust in people and institutions rather than political attitude per se that mitigates fear of the pandemic. To summarize, we find a negative and significant relationship between respondents' willingness to take risks or to delay rewards and their self-reported fear of the pandemic. Also, we find that trust in people and institutions was significantly associated with reduced fear. Policies that promote trust may generate positive economic spillovers by reducing fear during crises and encouraging investment. I'd like to thank you for your attention. Please reach out to me if you have any questions, and here is a link to our working paper.